Good afternoon. I hope you all are keeping safe and doing well during this pandemic. I know a lot of us are still homeschooling, staying at home, doing our part, supporting the community as much as we can, and I'm grateful to you all for doing that. One of the reasons why we're having this live today is the COVID-19 effects on our immigrant community. As you know, I have been calling for abolishing ICE and CBP since before this campaign, and I will continue to do that. Their role is unnecessary. It is hurting a lot of people. And right now, during this pandemic, ICE had asked for over 40,000 masks. And that means they plan on continuing to deport immigrants and to separate families and to cage children. This has to stop. Today, I'm hosting Mahsa Khanbabai, who is an attorney, an immigration attorney, and an advocate for immigrants. And she will be talking to us about what is the status for immigrants during this pandemic and what should a true COVID-19 relief package include. So Mahsa, thank you very much for being here today. You are from Easton, from District 4th of Massachusetts. If you can give us a little bit of an intro on your work for the immigrant community, and I'll let you lead the way.
Sure. Thank you so much for having me here. It's been really a strange time, a dangerous and concerning time for so many people. And so I'm glad to be able to come here and to talk about some of the issues that I'm seeing as part of the work that I'm doing. So as you said, I am from the Easton area. I've been living here for the last 13 years. And I'm an immigration attorney and have had my own private practice for roughly 20 years now. And I primarily these days represent a lot of community health centers and community hospitals, as well as small businesses and individuals with their immigration work and their immigration issues. And that can be a number of different things, from issues related to sponsoring employees for work visas or for green cards, or it could be a family member looking to sponsor their mother or their father or their spouse for a green card. And so I have had a lot of calls and questions, not only from clients, but also as the chair of the American Immigration Lawyers Association New England chapter. We're in a bar association of roughly 800 or more attorneys that specialize in immigration law throughout the New England region. And there are a lot of questions, obviously, not only about immigration as a whole, but what's particularly been happening now under COVID-19. So I'd be happy to talk about all of those different issues.
Mm-hmm. So Mahsa, can you tell us about what's happening to folks at the detention centers in Massachusetts?
Yeah, so just to give everybody a little bit of background, if a person is here out of status, let's say they've overstayed their visa for whatever reasons, and they come into contact with ICE, they may be detained so that they could be processed for an immigration hearing in front of an immigration judge who will make a decision whether or not they can stay in the United States, if they have some sort of basis to stay, or if they should be removed. And the rules have changed over the last few years in that in the past, people who didn't present any threat to public safety, people who have had no interaction with the criminal justice system, were typically allowed to be out of jail and not to be detained in jails where there are criminals, either convicted criminals or people who are awaiting a criminal trial and can't be released. So you have a really dangerous situation where you have individuals who oftentimes have had no interaction with the criminal justice system, are merely immigration overstays, and they're being held in these detention facilities that we all know typically have not had a very good record in dealing with medical issues. Mm-hmm. And there is a real threat and concern and it's proving to come true in the numbers of COVID-19 spreading in the jails. And there are individuals who are not only contracting it from other inmates, but also from the people working in the jail, and from people that used to come in and perhaps visit before everything got shut down. So there's tremendous worry, especially amongst, let's say, the elderly or those who are sick, who are being detained only, again, for immigration violations. And we're asking ICE to release these individuals, either on bond or like with an ankle bracelet or something like that, because most of them do have deep ties to the community. They've been around for years and years, were often working and had families. And we know that they're not a threat to this public safety, and they're not a flight risk. ICE, unfortunately, has not agreed to do that at this point and has continued to detain individuals. And we're still advocating for that to happen. There have been some lawsuits by different attorneys and groups such as the ACLU and other organizations demanding release for particular individuals who are able to demonstrate that they have health risks or other such factors. So it's really something that's quite worrisome for so many people, and it's just not appropriate for public safety, right? Those officers working in the jails are putting themselves and their families all at risk.
Mm-hmm, mm-hmm. So what do you think is happening right now with people who are overstaying their visas in this country because of the COVID-19 crisis?
Right, yeah, I mean, that's a tremendous area where there's lots of potential if the government only sat down and really thought about it and acted in the best interest of public safety. We have a lot of people here who are, for example, visiting or who are working and now their visas have expired, or maybe they've been let go and laid off, who have no capacity to leave the United States, right? There are just not enough flights and lots of other restrictions like travel restrictions that they can't leave. Some of these individuals are eligible to apply to try to extend their stay or maybe convert their visa to a temporary visa, like a visitor visa, but that's pretty significant in terms of cost. And it's really difficult to kind of do that right now when the people are supposed to be staying in their homes and not being out there in public. So unfortunately, the US administration has not done what many other countries have already done in allowing people to stay here and extending their stay automatically. We've seen that happen in a number of countries where the government has recognized that there's a public health crisis and people may not be able to extend their visa or may not be able to actually leave even if they wanted to, and have allowed all of these people extensions of whatever their status is. And then sadly, the US administration has not done that. I'm actually concerned that one would expect that even though this administration has demonized immigrants for the last 3.5 years, one would think that a pandemic would change that, right? That it would bring out a little bit of heart in somebody to say, look, we have a global crisis on our hands. Let's just do the right thing and help some of the most vulnerable people here. And instead, I'm really worried actually that the government will take this as an opportunity to continue to vilify and demonize immigrants and not cut them any room for them to be able to stay in the United States without having to worry about trying to extend their stay.
Yeah, I am very, very worried about folks losing their status and folks who are here visiting, like my mom is visiting and her visa is almost up. And in order for us to make this application, first of all, for many people, it will be unaffordable. It's almost $500 just for the application. You would need $1,500 to $2,000 for the lawyer. You would need to send it on time. You might be called for biometrics, and that means you're gonna stick your fingers in a machine that was not cleaned. There are no standards or precautions at those offices that we've been hearing, packed rooms at the USCIS offices. All of this is risking more spread of the COVID-19 It's risking the lives of people who are everywhere, either they're visiting or they're here. It's inhumane, and it's really saddening to see that, you know, people like my mom who are in the high risk category having to scramble to ask for an extension and go through a lot of paperwork that is unnecessary. This paperwork is also costing us a lot more. It's costing us, putting workers at a danger where they could catch the virus as well. It's the whole system is set up in a way to make people become undocumented. And for folks who host their families here, that means once their family member, you know, burns through the visa, that means they don't get to come back. They're sent to their home country and they don't get to come back as visitor again. And that is just really heartbreaking and worries me a lot.
Right. Yeah. I mean, I will say that the government is actually looking to raise fees for a lot of applications, which is going to make it incredibly burdensome, and that an average person won't be able to apply for some of these different applications, including the citizenship application. Recently, the government put out a call for public comments because they were nearly doubling the application fee to become a US citizen, which many found to be quite ironic, right? In that the government is trying to keep people from becoming citizens, yet trying to core, you know, the vote of different immigrant groups. So it's definitely something that's very worrisome. I can say that there was a little bit of silver lining in that finally, after lots of public pressure from many groups, including our Ihssane New England chapter, immigration offices have closed and all of the biometrics offices have closed. And they recently announced today that it was going to be closed through the end of April. They extended that. It initially was supposed to open in early April, and now it's been extended. So we'll have to just monitor that and see what happens. Now, in terms of the service centers where people would send in applications like your mother's, those offices are still open to accept mail and to accept applications. But as you said, first, people might not be able to afford it. And second, we don't know when they're going to make a decision, because obviously there is a slowdown, right? And in the meantime, people are waiting and unsure about what's going to happen. So it's definitely something very concerning for a lot of, you know, of our neighbors, right? Our families, our neighbors, our community. These are people that we live with, that we work with, people that are working in the restaurants. Oftentimes we kind of forget about who are the people that are still working in the grocery stores, that are working in the hospitals, in the schools, cleaning. There are a lot of individuals who are here either with temporary visas or without visas, and they're putting their lives at risk so that the rest of us can stay home and try to be safe. And so it's really sad to see that they were not really accounted for in that new CARES Act that just came out to try to help supplement people who've been laid off due to the coronavirus.
Mm-hmm, mm-hmm. We received a question, what will happen to green card naturalization applicants?
So individuals that are either waiting to have their green cards adjudicated or to have their citizenship applications adjudicated, they are still being processed remotely by officers of the Immigration Service. So the good thing is that a lot of them were set up to work remotely part-time. And so that is continuing, and I believe it's continuing on a full-time basis. Now, some cases may be able to be adjudicated. There may be able to be approvals on some cases that don't require interviews. But individuals who were waiting to become US citizens, unfortunately, those are on hold now until we hear further. But like I said, until the end of April, those are all put on hold.
Mm-hmm. Well, depending on when the elections would happen, that might actually affect the vote if they're not getting their citizenship on time.
Yes.
Yeah.
I do know that the New England region, which is known as District 11, has actually been a very great office to work with in terms of having really professional staff and leadership, wanting to make sure that individuals get the benefits in terms of green cards or citizenship that individuals are entitled to, and to process their citizenship applications in a timely basis. And they were really trying to accommodate individuals being sworn in for citizenship. But unfortunately, with the emergency declaration, that wasn't able to continue.
Mm-hmm, mm-hmm. So I wanted to ask you again about the ICE detainees at the Bristol County. They are on a work strike. They're saying conditions are unsanitary, and they fear the spread of the coronavirus. What are you hearing about people who are detained there?
Yeah, I have several colleagues that I work closely with that do have individuals detained there. And unfortunately, all of the phones are shut down, so they're not able to call their attorneys. And they are incredibly concerned about the sanitary condition of the jails, and that it's not safe, and that there aren't enough precautions being taken, or even capacity, right? I mean, how could they, even if they wanted to be careful and to protect the detainees, how can they when there are such small spaces with lots of people, and there's really no capacity to control who the officers are that come in and out of there, right? They may have been exposed somewhere else and now are bringing it into the jail. How much can they have in terms of cleaning supplies or PPEs? So even if the sheriff wanted to treat all of these inmates with the utmost safety precautions that were available to him, it's just not feasible in a small jail like that.
Mm-hmm. Mm-hmm.
And of course, we all have our concerns anyway about the sheriff and what he's said historically. So again, take what I said with a grain of salt there about what he's capable of, right, and what he would actually really do with what resources he may have.
Yeah. Yeah. Well, we need to elect a new sheriff for sure. But I mean, a lot of what he's been advocating for has hurt the people of Bristol County in a really historic way. And it's hurting people directly. It's hurting people indirectly in terms of those who, stand with immigrants and stand with the incarcerated. It's hurting so many people emotionally. I have been out with Progressive Needham they came out every Tuesday and called for ICE to be abolished. Folks in the southern part of the districts in Fall River and Taunton have rallied with other folks in New Bedford to get Sheriff Hodgson to stop advocating for Trump policies. It's unless we are bold in really moving the needle and growing the progressive bench in Congress, these policies are going to continue to be harmful. We know that deportation happened under so many administrations, not only under the Trump administration, and that has hurt families continuously. And a lot of the time when we start to talk about relief, especially during crises, immigrants get left out. And we see that again now. We hear we're going to send relief for all Americans, but are immigrants considered in the all Americans? They're not. They're considered aliens. Even the words are being used towards aliens, towards immigrants, like the word alien is dehumanizing. It's already othering. And that those things really matter. Those things matter. So we are getting more questions here. Let's see. What can you tell us about undocumented immigrants being released? Undocumented immigrants won't be receiving, hold on, this question is a little bit, okay. So if can you tell us a little bit more about undocumented immigrants being released?
Yeah, I mean, sadly, they're just not being released unless there's a lawsuit filed by their attorneys. So, despite so many calls from many different advocacy groups, right, from physicians to former government officials to the immigration bar to prisoner rights organizations, ICE has really not been listening, unfortunately, and is not releasing anybody. They've not come out with a policy to do that.
Right. Undocumented immigrants, unauthorized workers make up about 5% of the US labor force, around 7.6 million people, according to the latest estimates from the Pew Research Center. It's undocumented workers are still in the fields, still in the factories, still the janitors in the buildings. They're still looking for work as day laborers. From a public health perspective, you cannot have an effective national response to a pandemic that excludes enormous segments of the population. We know that undocumented immigrants do not qualify for public benefits. How will the stimulus impact mixed status families? Will the new public charge rules harm families where one person qualifies for the $1,200 one-time payment? And I know I've asked you this question generally before, but can you tell us some examples from how this workforce, right, 7.6 million people in the United States who are working right now, how are they going to be affected by this COVID-19 lack of relief from our federal government?
Right, yeah. I mean, what I'd love to do is break that down, actually, because there's a lot to that. There's actually an amazing organization or institute known as the Migration Policy Institute, MPI, and they recently came out with a report that broke down what percentage of workers and industries vital to the COVID-19 response are immigrants. And it's amazing that the data shows that healthcare and social services workers, 17% are foreign-born workers. So your home health aides, your nurses, your doctors, your techs, right? The respiratory techs that run the ventilator machines, I mean, there's a very large percentage of those that are foreign-born workers, right? When it comes to essential services or wholesale, like groceries, pharmacies, gas station, 18% are foreign-born workers. When it comes to manufacturing, for example, food and medicine and soap and cleaning agents, 26%. And when it comes to transportation, such as bus or metro or taxi drivers, for example, 34%. And then lastly, I just want to point to scientific research and development. 22% of those workers are foreign-born workers. Now, most of them are here legally, right? They have visas that allow them to stay here, or they have green cards, or they're citizens now. But there's a large majority of them that are not. They are now undocumented, they don't have legal status, and they don't have work authorization. Many of them are those still paying taxes. And that's really important to understand. Individuals can get tax-paying ID numbers, and that allows them to actually pay taxes as they work, but it's not a Social Security number. So even though they're paying taxes, with this new stimulus bill that passed, they are not going to be able to get unemployment benefits, even though they paid into the system, because of the way the law was written. And I know that a lot of Democrats really worked hard in trying to get that changed, and unfortunately we're not able to. So we're going to have vast numbers of individuals, from, you know, people working in the kitchen at the restaurants, or in the grocery stores, in the back room, or in the delivery. These individuals have been paying taxes, may get laid off now, and will not be able to collect unemployment, and will not be able to get that check which would help them survive, which would help them to continue to be an active member of our communities and people that we rely on day in and day out. So it's really, frankly, quite disgusting and sickening to see that the Republican Party purposely put this language in there to exclude some of these most essential workers to our society.
Indeed, I agree.
Well, I do want to say one other little thing about that, especially related to the healthcare workers, if I could. I know we're running out of time.
That was going to be the next question, yes.
Yeah, I know you might have questions, but I think this is so, so important to understand. We have residency training programs in the United States, right, that allow us to train doctors once they finish medical school and then to go into the workforce. 25% of those residents are actually foreign born. They're individuals that completed medical school abroad, they're from another country, and oftentimes they're physicians that actually were working as physicians in their home countries, but decided they wanted to come here for some extra training and to work in the United States. So roughly, I believe it's around 22% of physicians throughout the United States are foreign-born physicians, and actually my dad was one of them. And many of these physicians go and work in underserved areas, meaning communities that have a hard time recruiting American doctors. So right here in near where I live in Brockton, Massachusetts, we have an amazing community health center that, like many others in Lynn and Fall River, can't find American doctors willing to work there. And so they hire these physicians that were trained in the United States to come and work and to serve the populations that really need physicians. There are lots of restrictions on those physicians. Many of them are willing to continue to help and actually work to treat COVID-19 patients, but are unable to do so because of visa restrictions. And so we're advocating for that to be changed. And we're also advocating to broaden some of those other visa categories that I had mentioned earlier, like the technicians that are running the ventilator machines, the nurses that are helping the anesthesiologists treating those patients that are intubated. We need to be able to help a lot of these workers that are already here, plus individuals that have not yet been able to get their licenses. And so there is a chance for some of those bills to pass if the senators hear from their constituents to say, yes, I support having these colleagues of mine, these neighbors of mine, these people helping my family, my community, my neighbors, right, who are sick in the hospital. They should be able to get their visas extended, and they should be able to do it for free. These people are putting their lives at risk to treat COVID-19 patients, being exposed to them day in and day out. We should be able to let them apply for free. And actually, that's what the UK just did. And it's amazing to see how so many countries around the world value their immigrant workers and help them, especially at a time of a pandemic, where from the United States, they've been entirely silent. And in fact, the immigration bar, we have to continuously advocate to even ask for the little crumbs that they're giving us. So it's really, I mean, so essential that we all get out there and vote and speak about how we should be treating our immigrant neighbors and colleagues, and especially those in the healthcare field.
Thank you so much. And I know that your partner is also in the medical field.
Yes, my husband's a physician and treats pregnant women, and of course he can't let them go to the hospital. They'd be too exposed there. So yeah, it's quite concerning when there aren't enough, PPEs out there to help protect these healthcare providers.
Yeah, well, I hope your husband stays safe, and we're so grateful to our medical community for what they're doing right now. They are at the forefront of helping us minimize the effect of this pandemic. And it's really, we're so grateful to the nurses out there, to the doctors out there who are putting their lives on the line. Final question. So in addition to what you've already mentioned, what measures do you think state officials should take this year to protect all immigrants?
Yeah, I mean, there's a number of things that can be done. Is one, they can continue to reinforce that they'll be safe there by working with the federal authorities to ensure that ICE will not go to hospitals or clinics, um, and that they can make resources available when they are laid off, because they're not going to be eligible for federal benefits. The state making benefits available to these individuals is really key. The rest of it, unfortunately, is in the federal government's hands.
Thank you. For the package, we do have a wish list for what we actually need our federal government to do right now. We need to, one, release all ICE detainees. No one in there is actually being held on a crime charge, and available alternatives to detention are cheaper and more humane. We need to suspend all ICE arrests and deportations. This one is becoming moot as more and more countries refuse to accept them. We need to waive non-essential USCIS interviews and find reliable ways to do essential ones by video. Phone is not an option for many reasons. We need to, when immigration court is now suspended through May 1st for non-detained cases, but attorneys in many parts of the country are still being forced to come into court with witnesses. Boston Immigration Court has made it much easier, but we need national standards. We need to either cancel all detained hearings and let them out, which what I would prefer, or allow telephonic appearance for attorneys and witnesses by default. And finally, we need to extend relief payments to anyone who filed 2018 tax return, even with a TIN. And we need to make our policies universal. We need to stop asking people to file extra paperwork to get relief. We know that this is the humane way, it's the pragmatic way, and it's the American way. So with you, I am fighting for freedom for all, for justice for all, and all means all, and that includes immigrants, no matter the status. Thank you so much for being with us today, Mahsa. Lovely to have you on this Facebook Live, and thank you for all of our supporters. Stay safe and have a good evening.
Thank you.